Hi, I'm Brandy Bear, and along with my partner Muskan Sharma, we looked into using machine learning to predict physical activities with wearable devices. The motivation and context for our project is that 1 out of every 10 US adults wears an activity tracker. There are hundreds of different wearable devices available to consumers, but Apple Watch and Fitbit dominate the market with 49% and 17% of market share, respectively. The data from these activities is of enormous value to health researchers, with many clinical trials involving data from Apple Watch and Fitbit already underway. While the devices collect data on steps, heart rate, distance, and calories burned, activity level is an especially salient variable of interest for researchers. Activity level is used to predict health outcomes, inform treatment plans, and induce behavior change. However, researchers need to be sure that these devices can accurately predict physical activity level in order to use them for this purpose. Therefore, our objective is to determine how well Apple Watch and Fitbit can accurately predict physical activity levels and to find the best methods for improving that accuracy. The data that we use was collected and made publicly available by the Beat Lab in 2020 for their research in the field of population physical activity. There are over 6,000 records of minute-by-minute study data from 23 men and 26 women, each wearing both an Apple Watch and a Fitbit during 65 minutes of lab protocol of intervals of light, moderate, and vigorous activity, as well as rest. Along with activity level and device type, there are 16 other features, including age, gender, height, weight, steps, heart rate, calories, and distance. We performed a brief exploratory data analysis on the data set to get a better understanding of the problem and its domain. For this, we created a copy of the training set and set aside our test set before performing EDA to avoid any snooping bias that might occur. We found that the composition of the data reflected what was described in the lab protocol in terms of gender, and minutes of each activity type. We also found there was variation among key features between device type. And most importantly, we confirmed that the classes of activity level were balanced. Our approach had 6 main steps as listed here. First is data cleaning and pre-processing. As we know, data cleaning often involves many steps, as is the case here. Most importantly for our project was the encoding and feature scaling. We used label encoder for the activity label and one-hot encoding on the device attribute, which was the only categorical variable. We also used standard scaler to normalize the numeric variables so that they could be valued correctly. For example, age ranged from 18 to 56, while steps often range in the thousands. This had to be addressed in order to run the models correctly. Now I'll pass it off to Muskan to talk about feature selection.